Welcome to the Professional Nanny Trivia Game. These trivia questions are from the U.S. Nanny Association National Nanny Standards. These questions represent the skills and knowledge of certified professional nannies. My name is Elizabeth Malson. I am the Executive Director of the U.S. Nanny Association. I'm excited today to be your Nanny Trivia host. As we get started, please grab a pen or pencil and a pad of paper so you can keep score. What are our categories? Well, childhood health, special diets, positive discipline, parenting styles, development theories, and learning approaches. Our first category today is positive discipline. Positive discipline for 200 points. Which positive discipline technique is defined as guiding a child's behavior from what they are doing to a more desired behavior? Redirection. Positive discipline for 400 points. What is a logical consequence? The natural outcomes that result from a child's actions with others or property. The intent is to teach the child that every action has a reaction. Positive discipline for 600 points. What positive discipline technique is defined as a straightforward timeout and behavior system? 1, 2, 3 magic. Positive discipline for 800 points. Temper tantrums are frequent in toddler and preschool years when verbal communication skills are still developing. After the tantrum is over, how should the caregiver respond? Give the child a hug to convey that they're still loved and to empathize with the challenges of big feelings. Positive discipline for 1,000 points. What is the term used to describe gradually building a child's ability to manage his or her own emotions and behaviors with fewer immediate responses from the caregivers? Resiliency. As a child matures, caregivers should wait before jumping in to help a child through a challenging situation. If the child seems to struggle, then caregivers should step in and provide help and support. We finished positive discipline. What category should we go to next? Our next category is childhood health. Health for 200 points. What childhood rash is characterized by blisters in and around the mouth, the hands, feet, and genital area, as well as fever? Hand, foot, and mouth disease. Health for 400 points. What are the signs that a toddler may be ready for potty training? Pulling at a wet or dirty diaper and having predictable bowel movements, hiding pee or poop, or broadcasting when the bodily function is occurring, having a dry diaper for longer than usual, or waking up from a nap dry. Health for 600 points. When a biting incident occurs between toddlers, what should the caregiver do? Separate the children, comfort the bitten child, and tell the biter, no, biting hurts. Health for 800 points. What highly contagious rash is caused by mites? Scabies. Let's close out the category of health with 1,000 points. The symptoms of stress fall into two categories. What are they? Physiological and psychological. We finished positive discipline and health. Let's go to a new category. Our next category is child development theories. Development for 200 points. According to attachment theory, who establishes a sense of security for the children? Mother figures. Development for 400 points. What child development theory combines learning influenced by psychological factors and behavioral learning theory? The social learning theory. Child development for 600 points. What child development theory assumes that child development cannot be understood without reference to the social and cultural environments? The sociocultural theory. Child development theory for 800 points. What child development theory focuses on explaining how children change and grow over the course of childhood with different stages from birth through childhood, adulthood, and becoming a senior? The psychosocial theory. Closing out the development category for 1,000 points. The zone of proximal development is the gap or distance that exists between a learner's potential development and their current development. This zone of proximal development is a key component of which child development theory? The sociocultural theory. We have three categories remaining: special diets, parenting styles, and learning approaches. Let's move into the category of special diets. Special diets for 200 points. What diet is used to narrow down or identify the cause of an allergy or intolerance? The elimination diet. Diets for 400 points. What diet has been shown to help manage diabetes? Low simple carbohydrate diet. Diets for 600 points. What diet helps children with cystic fibrosis fight infection and maintain strength? A high-fat, high-calorie diet. Special diets for 800 points. What diet has been shown to manage the symptoms of epilepsy, stopping or reducing the number of seizures? The ketogenic diet. Finishing out the category of diets for 1,000 points. What is a low FODMAP diet? FODMAP diets eliminate one food category at a time to help those with irritable bowel syndrome. Categories can include eliminating dairy or lactose, sugars or fructose, fructans, and polyols. Two more categories remain in our professional nanny trivia game. Our next category is parenting styles. Parenting styles for 200 points. Sophia and Jack live with their biological parents. Major family decisions are decided by their father. What type of family dynamic does this represent? A patriarch. Parenting styles for 400 points. One approach is characterized by parents who expect the children to follow a specific set of rules and expectations, using punishments as needed. This refers to what type of parenting? Authoritarian. Parenting styles for 600 points. One approach is characterized by allowing the children to analyze and recognize the issues confronting them. This refers to what approach to parenting? Authoritative. Parenting for 800 points. Isabella's parents do not provide a lot of guidance for Isabella. They don't have many expectations of her, but they do reward desired behaviors. What is their parenting approach? Laissez-faire. Let's close out the category of parenting for 1,000 points. Mila's mother referees every fight and dispute that involves Mila. She consistently advocates for her daughter and limits Mila's ability to advocate for herself and navigate social interactions. This type of parenting aligns with which stereotype? Lawnmower parenting. We have finished childhood health, special diets, positive discipline, parenting styles, and development theories. Our final category is learning approaches. Learning approaches for 200 points. This learning style views the child as one who is naturally eager for knowledge and capable of initiating learning in a supportive, thoughtfully prepared environment. Montessori. Learning approaches for 400 points. What is it called when behavior can be changed based on a reinforcement, either positive or negative? Operant conditioning. Approaches for 600 points. This learning philosophy is about respect and trust in the baby to be an initiator, an explorer, and a self-learner. It encourages parents and caregivers to provide an environment for the child that is physically safe, cognitively challenging, and emotionally nurturing. Rye. Approaches for 800. This learning style views young children as individuals who are curious about the world and able to learn from all that surrounds them. It's based on self-directed and experimental learning in relationship-driven environments. Reggio Emilia. Our last trivia question for the day, approaches for 1,000 points. This learning style enlivens capacities of the human being as the individual moves through the phases of this life in 3 distinct development phases. These phases are based on 7-year spiritual cycles, ages birth to 6 years, 7 to 13 years, and 14 to 21 years old. Waldorf Steiner. So what's your final score? I hope you enjoyed our positive nanny trivia game as we covered childhood health, special diets, positive discipline, parenting styles, development theories, and learning approaches.